Hello everyone, myself Dr. Manu Batra, Professor in Department of Public Health Dentistry at Surendra Dental College and Research Institute, Shri Ganganagar, will be your course coordinator for a MOOC course on basic epidemiology. The various course modules will be Fundamentals of Epidemiology, Descriptive Studies, Case Control Studies, Cohort Studies, and Experimental Studies. Coming to Module 1, that is Fundamentals of Epidemiology. First of all, we should know what the term epidemiology means. It can be broken into three segments: epi, which means among, demos means people, and logos, that means study. So, epidemiology is the study of population. Going into brief history, Hippocrates was the first known epidemiologist who said no disease is sent by evils or demons, but is the result of natural causes. Claudius Galen said that reason alone discovers some things, experience alone discovers something, but to find others, we require both experience as well as reason. Thomas Snedden wrote the history of disease and became the founder of epidemiology, whereas John Snow is considered as the father of modern epidemiology as he studied the epidemic of cholera in London in 1854. W. H. Frost in 1927 became the first professor of epidemiology in United States of America. Coming to the definition of epidemiology, it has been defined by John M. Last in 1988 as the study of distribution and determinants of health-related states or events in specified populations and the application of study to the control of health problems. Disease frequency, distribution of disease, and determinants of disease. These three terms are quite frequently used in epidemiology. So, we should be aware about these three. Coming to disease frequency, it is measured in terms of rates or ratios which are essential for comparing disease frequency in different population or subgroups of the same population, giving clues to disease etiology. Whereas distribution of disease, it examines whether there has been an increase or decrease of disease over time span, whether there is high concentration of disease in one geographic area than in others, whether disease occurs more often in men or particularly age group, suggesting the measures to control or prevent the disease. Determinants of disease, it tests etiological hypothesis and identifies the underlying risk factors of disease which requires use of epidemiological methods. What are the various aims of epidemiology? The basic three aims of epidemiology are: first is to describe the distribution and magnitude of health and disease problems in human population. Second one is to identify etiological factors in the pathogenesis of disease. Another is to provide data essential to the planning, implementation and evaluation of services for the prevention, control and treatment of disease and to the setting up of priorities among those services. Now, what are the principles of epidemiology? First and foremost is exact observation, which should be strict, vigorous, accurate and precise. There should be correct interpretation, which should be free from any error. Then rational explanation should be given for the findings based on the intelligence and sensible, and it should be reasonable. And last is scientific construction. by the expert knowledge and the technical skills. Coming to the difference between epidemiology and clinical medicine. Unit of study in epidemiology is population, whereas in clinical medicine, an individual or a person is treated as a single entity. Under epidemiology, the relevant data is collected, identified source of infection, then mode of spread, and various measures are studied. Whereas under clinical medicine, that individual case, diagnosis, his prognosis, and prescribed treatment is studied. Epidemiology is concerned with both sick as well as healthy population, whereas clinical medicine is often concerned with those with sick in nature. Investigators in epidemiology goes to the community, whereas in clinical medicine the patient visits the doctor. Epidemiology is more or less conceptual. Results are made in the forms of tables and graphs, whereas clinical medicine it's based on biomedical concepts, refining technology of diagnosis and treatment. Coming to various basic measurements in epidemiology. Various measurements in epidemiologies which are encountered are measurements of mortality, morbidity, disability and natality, measurement of the presence, absence or distribution of the characteristics or attributes of the disease, measurements of medical needs, healthcare facilities, utilization of health services and other health related events, measurements of presence, absence or distribution of environmental and other factors suspected of causing the disease, measurement of demographic variables. Coming to various tools of measurements. The basic tools of measurements used in epidemiology are rates, ratios and proportions. First, rates. It measures the occurrence of some particular event, which can be a development of disease or the occurrence of death in a population during given period of time. Example is death rate, that is number of deaths in 1 year divided by mid-year population. Coming to ratios, it expresses a relation in size between two random quantities where numerator is not the component of denominator and both involves an interval of time. Examples is weight upon height. Next is proportion. It is a ratio which indicates the relation in magnitude of a part of the whole where numerator is always included in denominator and usually expressed as a percentage. Example is 20% of population suffers from diabetes. That means out of 100 people, 20 people is having diabetes. This is the example of proportion. Another term which will be used quite frequently is prevalence and incidence. So what is prevalence? It refers spatially to all current cases existing at a given point in time or over a period of time in a given population. There are two types of prevalence: point prevalence and period prevalence. Point prevalence is the number of all current cases of a disease at one point in time in relation to a defined population. whereas period prevalence measures the frequency of all current cases existing during a defined period of time. Now coming to incidence. It is the number of new cases that will occur within a population during a specific time period. It can be number of new cases of specific disease during a given time period divided by the population at risk during that period into 1000. Relationship between prevalence and incidence. Given the assumption that the population is stable and incidence and duration are unchanging, the relation can be expressed as prevalence equals to incidence into the mean duration. That is P equals to I into D. Now, what are the uses of epidemiology? Epidemiology can be used for community diagnosis, for studying the rise and fall of disease, for planning and evaluation, evaluation of individual risk, syndrome identification in community, search for cause and risk factors for the new diseases, completing the natural history of disease. Now coming to the classification of epidemiology. Epidemiology can be broadly classified under two heads: observational, another is experimental. The basic core difference is that under experimental epidemiology, there some kind of intervention is being conducted. Further, observational can be divided into descriptive and analytical epidemiology, and analytical again can be divided into either cross-sectional, ecological, case control or cohort study type. And experimental epidemiology can be divided into randomized control trial, field trial and community trials. The description of the following study designs will be performed or will be told in the further modules. Thank you for your patience listening.